Starting is into Brother Nazir.
Yeah, now you're live.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakallah khair. I think we're just going to start a quick introduction for this interesting meeting, inshallah. Little presentation, Dr. Wajid Akhtar. I think Dr. Wajid quite well known in the UK, but I think I should probably maybe produce a quick introduction. I know him for a really long time. Dr. Wajid, mashallah, he's a GP principal in London, in Essex, and he's a medical tutor in social media and medicine at St. George University in London. Also, they teach the topic of history of medicine at Park Medical School. He was the founder and mashallah been participating in many presentations after he found the Islamic history channels and gave many talks on that topic. On the other side, mashallah, Dr. Wajid, he wears many hats. He's the current Secretary General of the MCP, Muslim Council Britain. That's one of the biggest umbrella for Muslim community in Britain. He was the founder and former vice president for the British Islamic Medical Association, BIMA. And more interestingly, actually, Dr. Wajid, he worked in many projects within BIMA and also FIMA, the Federation Islamic Medical Association, which he's going to present, inshallah. This is the series number 17, the talk number 17 in this series on the history of Islamic medicine. He led the one of the project, Lifesaver in FIMA. And I think, with no further ado, I would probably maybe leave the mic to Dr. Wajid to start his talk. And inshallah, we'll have after 40, 45 minutes, 50 minutes maximum, inshallah, we'll be having some question answer session. Inshallah. Jazakallah khair, Dr. Wajid. Take care.
السلام عليكم ورحمة الله وبركاته. الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين نبينا محمد وعلى آله وصحبه وسلم وإليه تسليما جميعا كثيرا. Jazakallah khairan everyone for giving me a chance to say a few words on this very interesting topic on public health. So today I want to take you on a brief journey through history, looking at how the Muslim world not only pioneered public health, but how over time we experienced a decline in this vital field. So public health is a science and practice of protecting and improving the health of communities through organized efforts. We know many of us who are in this call, we are healthcare professionals and we are doctors or nurses or medical students. So we all individually do our part to help look after somebody's health. But public health is looking at it in an organized way for the whole population. What can we do? And the focus of public health, as you know, is disease prevention, promoting health, prolonging life. So let's start with Islam itself, with the Seerah. During the life of the Prophet ﷺ, public health had a revolution, because during the life of the Prophet ﷺ, Islam was revealed, and this was the first major religion that you could almost say that it couldn't have been designed better. If a public health scientist, if somebody who was involved and lived and breathed public health was to design a religion, it would be Islam. And this should be something that we should talk about as Muslim healthcare professionals, because the number of people who are leaving Islam is huge. People who are born into Islam and then they decide, you know what, I just happen to be born into this religion. Probably it's not the right religion. If I was born in a different religion, I would have been that religion. So you have to prove to yourself again and again, why is this religion the true religion? What is it about this religion that makes it the true religion? And public health for me is a definite hujjat al-Islam, right? A proof of Islam. So let's go through a few examples. You see, the Prophet ﷺ has a hadith, an-nizafa nisful iman. Cleanliness is half of faith. No other religion has this. The emphasis on cleanliness, the emphasis on hygiene. It's not just that one hadith. If you read the books of hadith, if you read the seerah, the emphasis comes again and again and again. God is clean and loves cleanliness. God is beautiful and loves beauty. What is beautiful? Cleanse with all that you can, for Allah has built Islam on cleanliness. And the only ones admitted to paradise are those who are clean. In fact, in one narration, it is said that Masjid Quba, why was Quba given the honor of having the first mosque? The Prophet ﷺ stayed there and he built the mosque there before he went to Medina. It's because the people of Quba used to use water when they cleaned themselves after going to the toilet. They wanted to clean themselves. They went the extra step to use water at that time. And this is not according to everyone, but this is one interpretation. This is why Quba was honored. And up to now, if you go to Medina, you go to Masjid Quba. So cleanliness is a huge thing. How huge? Cleanliness was the way that people recognized we are Muslim. I am originally from India. So when the British, they wrote a book, you can see it in the British Library. They wrote a book for their officers who are going from England to India. How can you tell whether someone is Muslim or they are not Muslim or they are a different religion? The way that you could tell, because everyone had a beard, we all have the same color skin. How could you tell? They said if they are clean, if they are wearing clean clothes, and they are taking extra care on their hygiene, if you are in an area where it is a clean area, there's no smell, that's the differentiating factor. That's how people would recognize us. When we lost Andalusia, there were Muslims who were still there. Many Muslims, they left. They left to the Ottoman Empire, or they left to the Maghrib. The ones who remained behind and who had to pretend to convert, they said, you know how we can tell? Because they felt in the Spanish Inquisition, these people, they are not really Christian. They are secretly Muslim. So how do we know that how can we find out that they are secretly Muslim? They sent the inspectors to the streets, and they said, look outside their house. If you see in the water channels, the sewage system, there is an increased water in the sewage system on Fridays, take them and kill them. Take them and kill them, because they are still Muslim. They are bathing on Fridays. That's how they knew we were Muslim. So public health is part of seerah, not just cleanliness, by the way. But you can imagine, is there any other religion in which you have to wash 5 times a day? Your hands, your feet, your face, 5 times a day. And once a week you have to take ghusl. And every time if you have any relations, you have to take ghusl. What other religion has that? Beyond the cleansing, right? And remember, you're saying that right now you might think, well, everyone takes a shower. Not back then. In those times, who took a shower? The same Isabella, Queen Isabella, who took Granada and hated Muslims. She made a boast that I have never taken a bath in my whole life, because bathing was seen as a dirty thing. You have to take off your clothes and you have to put water on yourself. I have never taken a bath in my life. And Queen Elizabeth I of England, she established a commission to decide how many times she should take a bath. And the commission decided that she should take a bath once or twice a year, and she said, I will take a bath only once a year. So this is what we were dealing with. I'm comparing the kings and queens to what the average Muslim was like. It's not just cleaning. It's about how we use the toilet. It was about how we even cleaned our mouth, right? The Prophet ﷺ would use a miswak. He was dying and he saw his brother-in-law was using a miswak and he indicated for it when he's dying. Dental hygiene. It's not just that. It's food. How you eat the food. The human being has not filled the vessel worse than its stomach, and it is enough for the human to have a few morsels of food just to straighten his back. You don't eat, you eat to live, you don't live to eat. But if you must eat, then a third for food, a third for drink, and a third for your breath. Where else? You don't need to have a lot of fancy dieting and paleo diet and also all of these kind of things. And you avoid food that is rotten. And you avoid, and we need to be aware of sexual health. So you do not go with everyone. You have to have marriage partners. You have to have partners in certain categories, in certain ways, and certain times. You need to avoid intoxicants. You're not allowed to have anything that can harm your body. This is a religion that was built on public health. It was built on health, not just public health, the narrow physical health, mental health. Smile, it is charity. Subhanallah. Subhanallah, I understood, really understood this hadith only last year. I was reading an article. A man, he wrote down his experience with depression. And he said, I had decided to kill myself. I had decided I'm going to kill myself. And I was going to jump off a bridge. And on my way to jumping off that bridge, I passed by someone. I don't know who it was. I never saw them again, but they looked at me and they smiled. And they smiled and it made me feel something. That somebody smiled. Immediately I smiled back at them. And I decided I'm not going to kill myself. Smile, it is a charity. A charity anyone can give. If you have no money in your pocket, you smile at your fellow human being. Spread salam. Peace be upon you. So many things. Give gifts to each other. This whole religion is built on public health. And of course, after the Prophet ﷺ, the Sahaba, and the early generations of Muslims, they continued down this trajectory of public health. They took it seriously, by the way, because this was the teachings of our Prophet ﷺ, and they took it very seriously. How seriously? This is how serious it was. Abu Ubaidah ibn al-Jarrah radiallahu anhu was one of the Ashra Mubashara. He was the one after Umar radiallahu anhu. Everyone agreed. It was consensus. Like it was consensus for almost everyone that Abu Bakr anhu was the first Khalifa, and then when Abu Bakr anhu was dying, he didn't say, I'm going to choose X, Y, and Z. He just said, Umar anhu is in charge, and people were upset that Umar anhu was a bit strict, but no one disagreed. Now Umar anhu was in his head. It was very clear who is going to be the next one. Abu Ubaidah ibn al-Jarrah anhu, no question. What happens? Abu Ubaidah is in Syria. And the area that he is in is affected by the plague of Amwas, the plague of Justinian. And Umar anhu hears about it and he writes immediately to him, come back to me, save yourself. And Abu Ubaidah anhu, who never, ever would go against Umar anhu, would never disagree, would obey his leader, he said no. The Prophet ﷺ told us, when the plague comes, you do not leave and you do not enter. And I'm not leaving, and I have to stay here until the will of Allah is passed, and that's what happened. Abu Ubaidah ibn al-Jarrah died in the plague. Subhanallah. That's how seriously they took it. And because of that, Umar anhu was left with a situation where he had to choose one from others, and he wasn't able to choose directly, so he had to make a committee. So this was serious. They didn't just take it in these matters. I'll give you another example. This is an interesting story, and I apologize. I know I speak through stories because you will remember the stories, and I hope you tell these stories to your children because this makes these people, they come to life. When the Sahaba were conquering, they were conquering Rome and Persia at the same time, which has never happened in history. You should tell your children this, right? Rome and Persia, the two biggest empires for 1,000 years, conquering the world, so huge, they had everything in their midst. You can still see their buildings to this day. And out of nowhere, out of the desert, these guys come and they conquer not one of them, but both of them at the same time. It is, again, your iman. It's a proof that this is a true religion. There's a book written by a professor of war called John Keegan. He wrote down that in every single other time you can explain why something happens like this, because they had a new innovation in technology or something happened, you can explain it. Except when the Muslims came out of Arabia, there's no explanation. Of course, we know the explanation. It's our religion. That faith, it drove people who were the same people, not that their ancestors were killing each other. The same people who are burying their daughter and killing each other for a chicken are now conquering two superpowers at the same time. So when they went into Persia, they took over a town very quickly and everyone ran away. When they took over that town, the people literally, they left while they were like they were in the middle of their business. It's not like they planned, they left unplanned. So the Muslims entered the town and they saw it. They said, we found pots, and inside these pots were something very strange we had never seen before in our life. And we took it to our commander, and our commander said, what is it? And we said, we don't know. It could be food, but the Persians, they're very good at poison. It could be poison as well. They could have left it for us. So he had a very good idea. He said, listen, we're hungry. Give this to some of the camels and the horses, and let's see, not all of them, just give it to some of them, and let's see tomorrow what happens to them. If they are well, then it's food and we'll eat it. And if they are dead, then it's poison and we have saved ourselves. So this is a good idea. So they fed some of this stuff in the pots, the white stuff, to some of the animals, and they watched them very closely. How is the animal all night, coughing, anything. Next morning, the animals are still there. They look quite happy. So then they said, let's eat it. And this is how the Arabs discovered rice. For the first time, they never saw rice in their life. Public health. It requires you to have an indication that before we touch something, what is the benefit of it, what is the harm, and we should experiment. And there are many stories you can write about Ibn Sina. Ibn Sina has a whole section in his books about food, how you should eat, what food you should eat in the summer, what food you should eat in the winter. I'm a GP, a family doctor, so every day I see many patients. They come, doctor, I have so much pain in my stomach, I'm feeling dizzy. I was like, you're constipated and you have not drinking enough. How much water do you drink? I don't drink water. I drink tea. I drink coffee, 10 cups of coffee. Okay, so you're dehydrated. It's summer weather and you're dehydrated and you eat pizza and junk food and you're constipated. So Ibn Sina was dealing with this all this time ago. Not only was this, but the whole Bimaristan. I did a different talk previously about the Bimaristan. The Muslims developed the concept of Bimaristan, the hospital. Right? Before them, it was only for a place where people went to die. And you had religious orders there, but there was no cure, there was no nothing. When Muslims built the Bimaristan, we built it separate wards for men and women, separate wards for physical and mental disability. You would have ward rounds. The senior doctor would be coming with the junior doctor to educate them. So, and every Muslim city of note had a Bimaristan. Damascus, Cairo, Delhi, Tehran, wherever it may be, Isfahan, they had Bimaristans. You can go there, you can see it. If you go to Damascus, inshallah, now you are able to go. you will see that Bimaristan Nuri is still there. And there was a Turkish slave soldier, a Mamluk. He became very ill and he got treated in Bimaristan Nuri, which was made by Nuruddin Zaki, the mentor of Salahuddin. He was so happy that he promised himself that if I ever become the emir, I will build one as well. And lo and behold, he was Al-Mansur Qalawun, who became one of the greatest Mamluk sultans, and therefore he built one as well, free at the point of use. It had free medicine. It had mobile medicine, so that if someone is too sick to come to the hospital can go to them, which we call an ambulance. They say that ambulance was invented by one of Napoleon's doctors. Muslims were doing it 500, 800 years before, but we don't get credit for anything, and we don't know about it ourselves. But public health in the Muslim world was at a different level. At a different level. While the rest of the world, they were still living in mud huts. They did not understand the difference between cleanliness and dirt and hygiene and public health and personal health. Muslims in Cordoba, you had 100 hammams. Hammams where you go and you take a bath, because Muslims need to take a bath. You didn't have a bath in your home like we have today. You would go to the hammam. There was a hammam culture, right? This is where the mothers would look for their daughter-in-law, for their sons. You would see who's healthy, who's unhealthy, what their behavior is like, what their mannerism is like. So they had the hammam culture. Not only in India, if you go to the Mughal palaces, the water, this is something we only discovered recently, that there's water flowing around because they built the entire palace. Sometimes the palace is a mile long on a gradient, like a minor gradient. It's not like a slope like this. It's a minor gradient so that the water is continuously flowing. Sewer systems, food. The food given to the mental health ward patients in the Abbasid times was from the same garden, made by the same cooks as the Khalifa. Can you imagine if you went into the hospital and the king's chef made your food for you? Would you feel a little bit better? Yes, of course. They didn't have SSRIs, but they had something, they had a knowledge of public health, they had an understanding. They used to give in the Bimaristan, when you entered, they used to give you some money. Why? I didn't understand, like, why would they give you money? Because they understood what we don't understand today, that with money comes options. Quite often people are sick because they're too poor to be well. We tell people you should eat good food, organic food. I can't, I've got children, I don't have enough money to buy the organic, expensive food. I have to buy them the cheap stuff and fill their belly. Yes, you're telling me that I should go exercise. Where exercise? I live, 10 people in one room. How can I exercise? So they were doing all of these things. Muslims, they understood these concepts long before we did. But of course, it was not to be like this, because that was the rise, and then came the fall. Things started to change. And in the last 300, maybe 400 years, when you start reading the books written by travelers, Muslim and non-Muslim, you will start seeing that before they would write that the Muslim society is clean, it's beautiful, they're so advanced. Now they were writing the opposite. They're dirty, they're smelly, they're disgusting, they're superstitious, they don't understand the basics. Why? Because the Western world was on this trajectory. They were going through the Renaissance. They were asking questions. They were pushing science, and they were also trying to understand the world around them. And they were coming to the Muslim world to learn. And the Muslims, we know everything. We don't need to go anywhere. We don't need to learn from anyone. And we were too busy fighting. I'm going to go into the causes of the decline in a second, but I wanted to explain to you about the decline. So in Samarkand, if you ever get a chance, I would really recommend, if you have not traveled, go to Uzbekistan. It's very beautiful. Islamic history is there. The people are very nice. Mashallah, it's actually very cheap. So I would recommend to go to Uzbekistan if you can. In Samarkand, there is a lake inside the city. Beautiful city, beautiful lake called Bolo House. Houses means like a well or a lake. And there's a mosque at the edge of it, and there's some beautiful trees, and people would go and walk around it. The whole city was built around this big, beautiful lake. When the communists took over, and the Russians and the communists took over Samarkand and Uzbekistan, they saw this river and this lake, and they decided before they jump in, because everyone said, you can swim in it, etc. We swim in it, we wash in it, we drink from it. They were a little bit suspicious. This does not look very healthy. They tested it. They found 300 microorganisms which could cause serious health problems. 300. This is 100 years ago. They said this is dangerous. He's causing you all these health problems. And they were like, oh, we didn't realize. You didn't realize. This is the land of Bukhari. This is the land of Imam Muslim. And Imam Muslim was from more the Persian side. What have you guys done of Imam Mutrudi? But you didn't realize that this is causing you illness after illness after illness? So they drained the whole lake, and it's gone. It's still drained to this day. It's not just that. You would see that the non-Muslims, they would say, Cairo, the beautiful Cairo, Al-Qahira, it had bimaristans, it had palaces. They said Cairo is dirty. Cairo is so dirty. I saw it myself. There's a place in Cairo called the City of the Dead, because 1 million people live in a graveyard. Can you believe it? 1 million people, more than 1 million now, live in a graveyard, the graveyard of Cairo, because there's so many people moving into the city. They don't have place to stay. They don't have anything. So they just go to the graveyard, and in between two graves, they put some corrugated iron, and the whole family is living there. And the TV is there, and they're running the plumbing through there, and they're drinking water through there. Well, tell me, what are you drinking? The burial is happening, and you are eating and drinking and living there. What health is going to happen there? We have to ask ourselves what's going on. Now, but I'm going to tell you something, you guys should know this. The best way to explain, because I could give example from here, there, everywhere, is what happened to the Hajj. So, in Hajj, around the 1800s, it became very clear that the Hajj was extremely, unfortunately, disgusting in terms of health. There's no other word for it. Disgusting is the word. Already for more than 100 years before that, Hajj was very unsafe. How unsafe? One story will give you an idea, because there were all these Bedouin bandits that were running around, and they would, so when people would go on Hajj, it was like, I might die. Of course, not just from the journey, because bandits would come and kill you, and they would come and kill. The Bedouins, they would come, and they were Muslim, right? The Bedouins, they were Muslim, but we know, like, they were bandits first. Just like we see there are Bedouins in the army of the genocide army right now. There are many Bedouins in that army, and you will see we are the Israeli Defense Force, but we sit here and we are having iftar. I'm like, who are they doing iftar? And we have a masjid. Who's the masjid for? Because they have so many Bedouins in there. Not all the Bedouins, of course, I'm not blaming all the Bedouins, but they are enough. that they are there. And at that time as well, they would rob the caravans. So the one story, it will give you an idea of how dangerous it was, physically dangerous, security dangerous, that if you are on a caravan and you need to go to the toilet, you go to the toilet right next to your camel or your donkey. You don't, out of shame, right? If I'm traveling with somebody, I will go somewhere a little bit further, right? Maybe I will go behind the sand dune. Maybe I will go behind it. If there's a tree, there's no tree, right? On that way. But if there's somewhere, I will find somewhere a little bit private, just distance even. They said anyone, this was the rule. If you go more than 5-10 meters away from the caravan, you will die. 100% you will die. You will be caught by the Bedouins and you will be dead. So you go to the toilet right where you stand, in front of everyone, because otherwise you die. That's the situation of Hajj. So the security situation was bad, but the health situation was even worse. It was unsanitary. Richard Burton, the Richard Burton, he was a famous English explorer. He went on the Hajj. He joined the Hajj as a fake Muslim. He pretended to be a Afghani Muslim, and he learned Arabic, and he learned how to speak and everything. He said it was extremely disgusting. When they would sacrifice the animals, they would throw the head and the guts just anywhere. So he goes, the smell was everywhere, the flies were everywhere, people were sick. It was very disgusting. Now you might say, oh, he's a non-Muslim. Of course he's going to say that. No, there was a Muslim, Mirza Farahani, who said even worse. He said it goes that I cannot breathe at the Hajj, because if you try to breathe, you will become sick. So people would be dying, and people would be dying of infectious diseases, and the Ottoman Empire would send people on the street to find out who's dying and what they're dying of. And if they suspected someone was dying of an infectious disease, this is public health, right? What did they do? They would write a letter to Istanbul. How many days would that take? And then in Istanbul, they would have a committee who would meet and decide what to do. And then they would send the message back. And if they decided that this is really an infectious disease, then in Mina, the yellow flag would be raised. This is something we don't understand. We live in a different world, right? But this was for hundreds of years. They wrote down, this is written in the books, if the yellow flag was raised in Mina, it would be as if the day of judgment had arrived. People would go out of their tents crying and screaming. Their eyes would be stuck out. They would go, Ya Allah, what's going to happen to us? Because they know now that there is an infectious disease here and we don't have much of a chance. What is the chance? I'll tell you what the chance was. In 1831 was the first time cholera reached Mecca. Cholera was endemic to the Indus River, so the India-Pakistan area, and it reached Mecca. In 1831, that's when it reached. 1 in 3 of the Hujjaj died. 1 in 3. If you heard of the Russian roulette, the game Russian roulette. Russian roulette is a game where, if you don't know it, you have a gun, and the gun has 6 chambers. You put 1 bullet in the chamber, you flip it, and then you put it to your head, and you press the trigger. So the gangsters, or in the old days, that's what people do to show their bravery. They would put the bullet in the chamber, 1 bullet, and then spin it, and then click. And then they would give it to the other, who has the most bravery. So then the second person would click, and the third, because you have 1 in 6 chance that you'll blow your brains out, right? 1 in 6 chance, you blow your brains out. None of you would play Russian roulette. But on Hajj is 1 in 3 chance that you would die from cholera. This is 1831. That's the first time. What happened? So every Hajj, tens of thousands of people were dying of cholera. Tens of thousands. What happened? In 1847, was the first medical facilities that were set up to treat the people who had cholera from Hajj. Who do you think set up that facility? Was it the Ottomans? Was it the Mughals? Was it the Safavids of the Qajar dynasty? Was it the Sokoto or the Khedive of Egypt? No. It was the French. The French were the first one to set up the clinics to treat the cholera for Hujjaj. Because they were not allowed in Mecca and Medina. In their own, the parts of the Muslim world they controlled. Because the Hujjaj were coming to France. So they tried to treat it. Then the first international conference to deal with the cholera epidemics in Hajj was in Paris, not in the Muslim world, in Paris. This is all you need to know. You don't need to know anything else, right? You don't need to know anything else. Just like the only fact you need to know is the first Arabic book ever printed by printing machine, right? Not by hand, by printing machine. The first Arabic book was printed where? It was printed in Italy. In Italy. That's all you need to know. One fact, it tells you everything. Somebody can argue 100%. They can tell you books and whatever. You can throw it away. The first Arabic book was printed in Italy. Uskut bas. We know everything about you and your education and your level and what you are prioritizing. And the first conference on the cholera epidemics in Hajj was in Paris. We know everything about that tells you everything you need to know about public health in the Muslim world. Non-existent. Non-existent. Actually, it's worse than non-existent, and I will explain. So they had the first conference in 1847. In 1865, it was the worst outbreak ever, because this time it came from Indonesia and Singapore to the Hajj. And so many people were dying. And this time, the people who were dying, the Muslims, again, we have to say this. You have to be honest. We did some very terrible things. When the people were leaving the Hajj, and they were going back to Cairo, they were going to different parts of the world, the people who were in the ships, the ship captains, they were being asked, when they docked in Cairo and so on, did anyone have any infectious disease on the ship? And they said no, no one has infectious disease. What they didn't say was they had thrown 100 bodies overboard into the Red Sea. Anyone who got infectious disease, they just threw the dead body into the sea. And the sharks of the Red Sea became fatter and fatter, and in front of them, this is written by a German doctor. He said, I would see. He said that, he was sent to be a doctor in Jeddah, and he accompanied one of the ships. He said, it goes, my heart was breaking. I would see families, they would come on board the ship, and then one by one, the parents would die, and the parents would be thrown overboard into the Red Sea, and the little children would be crying, and they would see their own mother and father being eaten by sharks in front of me, but there was nothing, no janazah, no nothing. There was no, he didn't know janazah, he's not Muslim, but he said there was nothing. And these children were just left. And to be honest, he goes, the only blessing was that the children themselves died before they got to the other end. That's what was happening. Not one, not two stories. Tens of thousands. 1/3 of all the pilgrims were dying. So because the ship captains were lying about the disease that was reaching, they no infectious disease with us. Why? Because they're all dead. Of course, the disease is still there on the boat. They haven't died yet. That year, Hajj was in May. By June, 60,000 people had died in Alexandria. 60,000 by June. By July, it was in France and England. By November, it was in New York from the Hajj. So the non-Muslim world, they said, you know what, this is crazy. We are going to die because of what's going on in the Hajj. So they insisted upon the Ottomans. They said, we must have a meeting. We will do it in Istanbul. we're going to come and we insist on quarantine, hygiene, etc., etc., etc. And after some disagreements, they said, fine. But look at the injustice. Only for the ships going towards Europe. For the ships going back to the Muslim world, no problem. We're not going to do any quarantine, no checks, nothing. Because why? We don't want to reduce the number of Hujjaj. We don't want to put any block. We get money from this, right? The Sharif of Mecca, he's minting money. He needs money. He wants money. He's money mad. He's money hungry. He loves money so much. If you read about the Sharifs, you will know about them. What kind of people they were. How much they wanted money. They became so angry that after this conference they had set up, they sent their doctors to Jeddah and they sent medical tents. They incited the Hujjaj and they said, destroy the tents and kill the doctors. So that's what the Hujjaj did. The Hujjaj burnt down the tents, they broke all the medical facilities, and the doctors had to have armed guards. Because the narrative had been built up that these guys are trying to prevent you going on Hajj. This is un-Islamic. This is un-Islamic medicine. In 1893, out of 200,000 Hujjaj, 1893, more than 40,000 dead. Dr. Saleh Subhi was one of the doctors. He said that there was no change of clothes for the sick, so they were staying in the same clothes that they were ill in. They were vomiting diarrhea in. And he goes, they had no blanket even. I thought they had a blanket, but they were covered from head to toe in mosquitoes, in flies. It looked like a blanket, but it wasn't. I could only see their eyes. They were human corpses. It was so bad that the streets of Jeddah, they would just leave the dead bodies on the streets, just piling up in the streets of Jeddah in Mecca, where they were doing the killing of the animals. They just put the bodies in there. There's no, what can you do? This is how many people are dying. We don't have space. We don't have time. So they're sacrificing the animal and they're doing this. Dr. Izzuddin, another doctor, he said that when I saw them, the number of people dying, but the Hujjaj are just continuing as if nothing is happening, I realize that they are human beings that are more like machines. Their brain is not working anymore. And he goes, it's not just them. I think the whole ummah, our brain is not working anymore. You guys were listening to this story and you think, subhanAllah, that's awful, terrible. But that was 150 years ago. That's not now. Now it's worse. Let me give you some statistics now about public health. I want to give you these statistics. I want you to try to remember them, please, because it makes a huge difference to your motivation levels and to being able to motivate others. Today, 2025, 5% of all Pakistanis, 5%, 1 in 20, are addicted to drugs. Hardcore drugs, heroin, cocaine, marijuana. What will that society be able to accomplish if 5% of all Pakistanis are addicted to drugs? More than 1/3 of all Indonesian adults smoke. 1/3. What's going to happen when they get cancer? Who's going to look after them? Are they going to be a benefit or a drain on the economy? At least 25% of all Saudis are clinically obese. Some people say it's more like 50%, but the minimum is 25%. 25% clinically obese. But on the other hand, nearly 200 million Muslim children. We're 2 billion, right? We're so proud, 2 billion. You only know that one statistic. What about the other statistic? 200 million Muslim children are chronically malnourished. Not just Gaza. 200 million. We cannot get the food into Gaza. What about the others? We couldn't get the food to them. The brain, it's not working. The heart, it's not working. That's the problem. So in one part of the ummah, they are clinically obese. In the other part of the ummah, they are starving. Well done, guys. Public health, fantastic. Kazakhstan is a Muslim country, has a suicide rate of 14.6 per 100,000. That's in the top 20 in the world. Egypt has the 10th highest rate of diabetes in the world. Nigeria has the 3rd highest levels of stress in the world. India, Nigeria, and Bangladesh have the world's worst food hygiene. Iraq, Bangladesh, Pakistan, Indonesia, and Egypt have 5 million orphans each in each country. Turkey and Afghanistan have the highest rates of domestic violence in the world. In the world. And we have the worst health outcomes. Polio is eradicated from the whole world, except where? Pakistan and the Muslim parts of Nigeria. And you can go on and on and on. You should know these statistics, right? The statistic I like using with lifesavers at the end of this month, end of September, is lifesavers. And I hope if you're not taking part, please take part. In public health in Seattle, they teach all the children in school how to do CPR. So the chance of out of hospital cardiac arrest survival, if someone's heart stops on the street in Seattle, their chance of survival is 33%. 33%, subhanAllah. Do you know what the chance of survival is in Karachi, in Cairo, in Bombay, in Mumbai, in most of the Muslim world? 0%. 0% chance of survival. How much money does it cost to teach CPR? It doesn't cost any money. It's just knowledge transfer. But there needs to be someone willing to transfer the knowledge and someone willing to take it. So I told you these 2 stories, right? The rise of public health, the seerah, the Prophet ﷺ, the hadith, the bimaristans, the dental hygiene, the mental health, the different wards, the emphasis on the scientific method, all of this, right? We taught, I told you that, and then I showed you the other side, this rapid fall, so that we are the worst of public health anywhere in the world. And not only are we bad at public health, but we are almost anti-public health. So why? This is a big question, right? What happened? Did we have a different religion? Same religion, same hadith book, same Quran, same 5 prayers a day, same Mecca. What changed between when we were the epitome of public health and the hammams to when we are now the bottom rung? What changed is very simple. When I had a young student, he was artistic. Sorry, take a glass of water. He's very artistic, so he was upset. He said, why can't, in the old days we used to build Taj Mahal and Al-Hamra and beautiful buildings. Now we don't do anything, we don't build anything like that. And I said, how can you build anything when you don't have safety, when you don't have security, when you have corruption? When even the builder of the Taj Mahal, if his stomach was empty, he would not build it. Even the writer of the most beautiful poetry, the most amazing artist, the best doctor, if they've got a bomb coming on their head, or if they are under the thumb of some taghut, they're not going to achieve anything. Safety comes first, security comes first, freedom comes first, success comes first, right? Opportunity comes first. Then you are able to do all of these things. Public health does not flourish in this environment, this chaos that we built in the Muslim world. That's the problem. The lack of safety and security, the lack of unity, the lack of infrastructure means that our brain has become smaller. The same Muslim brain that used to look at the stars and wonder how far away it is and calculate it and get it right, the same Muslim brain that used to look at a disease and diagnose it, that same brain now is so narrow. We can only imagine the Western worlds and try to just add the Islamic label on it. We cannot imagine a world outside it. We are so defeated. We are so down. We are surrounded by corruption. When I see the medical students in the non-Muslim world, they are thinking big. I'm going to open a company and I'm going to do this and I'm going to discover the cure for this. When I see Muslim medical students, they're thinking, how do I make more money? I need to make more money. I don't blame them because they come from poor families. You have to survive. They have to help their family. So the Muslim world lost a few things. What's the lesson? The story of the rise and fall of public health in the Muslim world is showing us that public health flourishes in a society that invests in knowledge, a society that invests in inclusivity. Yalla, come, I don't care what your name is. I don't care what you look like. Come, I want you. I want to hear from you. I want to learn from you. I want you to share your ideas. A society that invests in institutions, not individuals. We invest in individuals, right? To be honest, when I go anywhere in the Muslim world, they talk less about the institution and more about the professor. Professor is this, professor is that, professor. Do you know this professor? Do you know that hell? This mudir, that mudir, all the time. No, about the institution, Allah, the institution is nothing, right? A society that invests in institutions more than individuals is a society that grows. And a society that is complacent, that is not thinking big, is thinking only about itself, is thinking about survival, is not going to be thinking about thriving. We have to change that, my brothers and sisters. You know, we have to think on a different level. When I went to my first FIMA President Council meeting with Dr. Sharif, we were representing BIMA, British Islamic Medical Association, and we were the last one to present. So we were at the end, and maybe 20, 30 other countries, they had presented their 5 minutes on what their activities were. And they had got up and they said, you know, we have done this vaccination campaign. You know, we have done this cataract campaign. You know, we have done this emergency aid campaign. We've done this, we've done this, we've done this. Just before it was our turn, almost before it was our turn, Dr. Sharif, he turned to me and he said something. It made my head spin. He said, can you imagine, Wajid, that because of the NHS, the National Health Service in the UK, every single thing everyone else has said is irrelevant for us. It's irrelevant for us. We don't need to think about vaccination campaign. The health service, it does it. We don't need to think how to get few extra people to have cataract surgery. The health service, it does it. We don't need to think, how can I pay for this poor person to get clinical things, because the health service, it does it. We do the extra because the health service exists. Because of the NHS, we're already starting at a different level. SubhanAllah, that lesson we need. Every Muslim country needs a our own national health service, free at the point of use, that is forward-looking, public health facing. As medics, individuals, we need to be thinking about health more than just, oh, this one is depressed. Here you go. Here's antidepressant. Why are you depressed? You're spending all your time on your mobile. Of course you're going to be depressed. We need to think about what's making them depressed. Why are they feeling like this? What is the societal problems that we need to talk about, that we need to engage in? Instead of giving more prescriptions, as medics, we need to ask those questions. It's our responsibility. Because I truly believe, and I'm finished on this point, and I know I've taken a long time, if the Muslim healthcare professionals, because we are everywhere, they need us. There are doctors everywhere, in every town, every city, every village. Alhamdulillah, if we started to think about public health like it is in the seerah, like it was at the time of the Prophet ﷺ, if we start thinking about global health rather than just local, about how to stop our society eating constantly good food. We have kabsa and biryani and this and that. Yes, you keep eating and then you keep dying. What about your young children who lose their father? He has a 40-year-old, he has a heart attack. What's going on here? You keep going online and you keep having mental health problems. You need to ask questions. What are your children going to? What are they seeing? You're not giving time, or you're beating your wife left, right, and center. Then you're asking yourself, what's this happening? What's that's happening? We need to be asking the next question. We need to be the promoters of public health. Every one of us, whatever we do, promote the public health. We need to promote justice. Lack of justice in the Muslim world is a public health disaster. Corruption in the Muslim world is a public health emergency. We need to say it. If you don't say it, no one is going to hear it. That one of the biggest killers of the Muslims is corruption. They'll say, how is that killing anyone? Because of corruption, we're not able to adequately deal with the fact that the government is earning money from taxes from cigarettes, and so it is allowing cigarettes, allowing the advertising of cigarettes, and then people are dying of cigarettes. We need to talk about it. We need to become public health revolutionaries and go back to our deen, inshallah. And if we do that, then you will see we will inshallah be able to change so much of what is happening, not only on the ground but also in our ummah. Jazakallah khairan, subhanallah wa bihamdika, nastaghfiruka wa atubu ilaik. Jazakallah khairan, everyone.
Jazakallah khair, mashallah. Brother Wajid, that's great talk. It's great to listen to the wisdom, akhi, mashallah. I mean, it's heartbreaking when you mentioned many things about this, the condition of the Muslim world. Obviously, I think you are quite right. The lack of safety, lack of unity is really heartbreaking. I'm happy to take few questions or maybe quick comments, please, like maybe 1 or 2 minute comments. I can see Dr. Majid Qatmi is already put his hand up, and then Dr. Abdullah Bajaber as well next, inshallah. Dr. Majid.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Try to make it very brief, لو سمحت.
Jazakallah khair. First, Dr. Sharif organizing this fascinating Islamic medical history, which we never learn or know it, most of us, doctor. And I'm so happy to see and meet for the first time this good man who has got many hats, as you said, MCB, BIMA, GP. Alhamdulillah. I only want to say I have been trying, I do TV, radio, public health for a long time I've been doing, but I have a special project to discuss with Dr. Wajid, public health for the 4 million British Muslims. And I prepared the data, what subject. The top one is smoking, which is higher than the English and British. I would like the top one to discuss with him, and the government can give us fund to organize to this thing. Then we have a big list in public health. I pick up what's relevant to the Muslim. Big list: cardiovascular disease among Muslims, high blood pressure among British Muslims, unhealthy safe diet, obesity, lack of physical exercise, preventing infection, preventing sexually transmitted disease, type 2 diabetes, gambling, cousin marriage, and this issue, obviously many non-Muslims have it, but we need to concentrate on it. I only want one thing from Dr. Wajid: to honor me, to allow me to meet him one day. I live in Enfield, close to Essex, as it look. We meet, we discuss to go reality. You raise what's going on in the Muslim world. Horrible, worse. But here our duty to our British Muslim, inshallah. Please, Dr. Wajid, agree with me to meet one day soon, inshallah.
Dr. Wajid, mashallah, he's a great, generous man. I should admit he's got great credit anyway dealing with the during the COVID time here in Britain, and managing many meetings with Muslim representative anyway, and the mosque to try to get the health regulations anyway during the COVID time. أخي الدكتور عبد الله باجبر تفضل أخي.
السلام عليكم ورحمة الله وبركاته.
الله بارك الله. Dr.
جزاكم الله
Abdullah
خير
is from
دكتور
Kenya.
شريف.
He's from the Islamic Medical Association in Kenya.
جزاكم الله Dr. Sharif as usual for having a lineup of great speakers, and today having a very close and dear brother to us, Dr. Wajid, who basically told us what we are supposed to know, that Islam in general, basically, as Dr. Sharif also mentioned in many of his talks, is all inclusive. And if we go back to history, not just from the scholars, but from the time of the Prophet ﷺ and our scriptures, you realize that it's all inclusive in the matters of health. It is. We were just thinking it's sad that sometimes we get to cram and remember the issues around, for example, hand washing as hygiene through the conventional means, and not tie it to our Islamic teachings on the same. As a pediatrician, we've been concerned on issues you mentioned about vaccinations and issues like that. And I have to mention this because I've seen quite a number of students, mashallah, here in the group, is that you have a responsibility beyond the words and the books. We are not comfortable in talking to our sheikhs. Issues around vaccinations and things like that sometimes tied to religious beliefs and cultural and things like that. And we have to turn our masajids and our communities into areas of public health awareness as students. Issues of nutrition, we also have to address it as students, inshallah. Shukran, jazakumullah khair.
جزاك khair. Barakallah. Do you want to add anything, Dr. Wajid?
I just want to add one thing on that. So the students, you are born with social media. You understand it. Don't get your professors. They don't use it. They didn't grow up with it. This is your responsibility. Please stop doing this. Or I'm eating this. I'm doing this. Who cares? If you did it, one of my students, she used her Instagram to educate her Muslim followers that we should eat a little bit more vegetables, not meat all the time, right? She taught 30,000 people in 2 minutes because she had the access. And I told her, you reached 30,000 people. I have not reached 30,000 people in my whole career. This is the power you have in social media. You're going to use it for junk, or you're going to use it to save lives. Who knows how many lives you can save? You can make a beautiful campaign. Stop smoking. Stop vaping. Stop this. Stop that. And eat more of this. Go out for walks. Mental health. Do it, please, inshallah.
Jazakallah khair. We got brother, is that Mustafa Saqqa?
Assalamu alaikum wa rahmatullahi wa barakatuh. Yes, Mustafa Saqqa from Ima, Uganda. Alhamdulillah. Thank you, Dr. Wajid, for the enlightenment, for the knowledge and wisdom. For sure, taught us. I am so glad for the knowledge you have shared. I only request for one thing, the audio recordings, because I came in a bit late. I request for the audio, or if you have a paper written, be very good and enlightened. Then I request Dr. Sharif, if it is possible, this is a moving presentation. Maybe we can partly be shared in FIMA, because Allah has FIMA is a very big challenge in public health. Thank you so much.
Inshallah, that will be recorded, and probably a few minutes after the presentation, it'll be shared, inshallah. Jazakallah khair. Anybody else would like to add? Brother Wajid, do you want to probably maybe conclude if you wish, please?
Jazakallah khairan for the opportunity. My request, don't let this be knowledge sitting on a donkey. Use it.
Yeah.
Use, like take a screenshot. I put this up. Take a screenshot, share the information. Use it to drive you. You are seeing our brothers and sisters dying in Gaza, in Sudan, and it's breaking your heart. But wallahi, you have the opportunity to save that. You will be asked for what you did, but you don't have the physical ability to save their life right now. You have the ability to save the lives of all the people in your country, in your neighborhood, who are smoking, who are depressed, who are suicidal, who are diabetes. You have the opportunity. This in your grasp. It's in your hand. You just need to try it. Allah,
Exactly.
and if you do it, Allah subhanahu wa ta'ala, this will change, and this will help us help Gaza. If we do it, because we are healthy. An unhealthy nation, a depressed nation, a diabetic nation is not able to look after itself, let alone it can look after any part of it. But a healthy, strong, vibrant nation, inshallah, which is forward thinking, it can look after itself and then look after others. So it's my plea, please, whatever you do, find the statistics, use the statistics, make this fuel to energy, bring some of your team together and say, how are we going to reduce the smoking? In our area, we want to just reduce the smoking, and then how are we going to get it further? How are we going to reduce it? Just small things, wallahi, stand up at a wedding and say, please, everyone, just reduce your sugar this much. Don't put, because let me tell you what happens. I see the one with diabetes and their leg is cut off and they're gone blind. Just cut down. Yes, some will say, why are you saying this? This is a wedding time. But many will listen, and it will put in their head, and they will remember, and you will save their life without even realizing it, inshallah.
I can't agree anymore, Akhi, mashallah. Barakallah feek. Jazakallah khair. Always nice to listen to you, Akhi, Dr. Rajit. Barakallah feek. Jazakallah khair. والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. جزاكم الله خير. We'll see you inshallah. السلام عليكم. السلام عليكم.
جزاكم الله خير.
السلام عليكم.
Assalamu alaikum, Doctor. Do you want me to end the meeting?
Please.
Okay.
I think we